Fractures stand for zygomaticomaxillary fractures. When looking at ZMC fractures, it's important to understand the anatomy of the zygoma. It's a complex tetrapod bone and has many different suture lines that are important. On all of our previous videos, I highlighted the importance of suture lines and how you have to make sure not to get them confused with fractures. Indeed, when we reviewed the nasal bones, for example, we talked about the nasofrontal suture, the nasomaxillary suture, and even the intranasal sutures. However, when it comes to zygoma and ZMC fractures, the suture lines are of critical importance to examine. The ones you will always hear about are your zygomaticomaxillary suture, your ZM suture. This is between your zygoma and your maxilla. Your zygomaticofrontal suture. This is between your zygoma and your frontal bone and is here. Your zygomaticosphenoid suture, or your ZS suture, that is between your zygoma and your sphenoid here. And finally, your zygomaticotemporal suture, ZT. This is between your zygoma and your temporal bone and is seen here. The reason these suture lines are of such critical importance is that whenever you suspect a zygomatic fracture, you must make sure to examine all four suture lines for displacement or possible fractures. Indeed, that will guide our approach to looking at the zygoma and assessing for ZMC fractures when viewing a CT scan. As you can see here, the zygoma forms a border of the lateral orbital rim, inferior orbital rim, the floor of the orbit, and the lateral wall of the orbit. So it's incredibly important to remember all the lessons you learned in the module on orbital fractures, as the zygoma is intricately related. Fractures of the zygoma can vary from a simple, non-displaced fracture at the zygomatic arch to a complex tetrapod fracture involving all four suture lines and even fracture of the zygoma itself. Because of the zygoma's prominence in the lateral face, it is vulnerable to fractures, especially when forces are transmitted to the bone and thus to its suture lines. Okay, let's jump on a CT scan and I'm going to walk you through those suture lines that we just saw. First, I'm just going to show you them on a coronal view, as it's similar to the picture you saw. And then after that, we're going to go through our approach to ZMC fractures and the steps we're going to take when analyzing the scan. So first off, if you look at your ZMC, you'll see the zygoma. We'll focus on the patient's right side for now. Here we can see a suture line in between the zygomatic bone and the maxillary bone. As you can tell, it's incredibly faint, and sometimes these suture lines are hard to appreciate. This represents our ZM suture. If we go more superiorly here, we see this noticeable suture line between the frontal bone and the zygomatic bone. This represents our zygomaticofrontal suture, or ZF suture. If you go more inside the orbit, it's very hard to see, but you can see a faint line here and a faint suture line representing our ZS suture, or zygomaticosphenoid suture. This is one of the most difficult suture lines to appreciate, but is very important to look at. Finally, in this view, it's very difficult to see, but you can see faint outlines of the ZT suture, or the zygomaticotemporal suture, between the zygoma and the temporal bone. Remember, the temporal process of the zygomatic bone and the zygomatic process of the temporal bone form the zygomatic arch. Now that we've gone over the suture lines, let's talk about our approach to the ZMC region. Once again, we start off at our maxilla and we begin to scroll up superiorly. It's always important to take it one side at a time and in a stepwise fashion. For now, the first thing I'll look at is the maxillary sinuses. Remember that the zygoma articulates with the maxilla on a pretty broad plane, meaning it has attachments to both the anterior and lateral walls of the maxillary sinus. Therefore, the first region I look at is the maxillary sinus itself and the anterior and lateral walls, looking for any step-offs or fractures. Once again, remembering that hemosinus, or blood in the sinus, and fluid in the sinus can act as a clue that a fracture exists. However, you always need to examine because hemosinus may not always be present. After looking at the anterior and lateral walls, scrolling all the way through the sinus, we're ready to move on. The next step would be to look at the zygomatic arch. As we follow the zygoma posteriorly, you'll see it form a nice broad arch articulating with the temporal bone. And we'll see our ZT suture come into better view here. When it comes to the arch, it can be tough to delineate small or minimally displaced fractures, especially ones that occur at the suture line itself. It's always important to look at the overall shape of the arch as well. Although sometimes it may look like the arch is convex, that's more because of the curvature of the temporal bone posteriorly here. In fact, your arch segment itself should usually be a straight line. In this patient, the arch is a little bit concave, which is a variant of normal anatomy. But in reality, whenever you look at a number of scans, you'll realize that the arch, when viewed in an axial view, is actually straight from anterior to posterior. Best seen here. So when examining your arch, if you see any breaks or obvious fractures, or if you see that the arch is kicked in or kicked out, you should be suspicious of a zygomatic arch fracture. Now, after we've looked at our arch, scroll back, and as we go more superiorly, the next thing we're going to look at is our ZS and ZF suture lines. The ZS suture line is tough to see, but remember, if you examine the lateral orbital wall, you should be able to detect any fractures in this region. In addition, if you go more superiorly, you'll be able to see the connection between the zygoma and the frontal bone or the suture line here. This is your ZF suture area. It'll become more obvious when we see demonstrations of fractures, how these areas can be displaced, but those are the 4 suture lines you always want to check when doing your approach. As we move on to our coronal view, we've already discussed the 4 suture lines and where they are. But when examining, going from anterior to posterior, you would want to take a look at your inferior orbital rim, your orbital floor, your maxillary sinus walls, your ZF suture, your lateral orbital wall, as well as your connection with the temporal bone in the zygomatic arch. These are all done one at a time, and as you can tell, there's an intricate relationship with maxillary sinus fractures, orbital wall fractures, and zygomatic arch fractures. This is why, once again, similar to your NOE fractures, you may appreciate one fracture at a time and then eventually describe it as a ZMC complex fracture. For example, when doing your scan, you might not realize at first that you're dealing with the zygoma fracture, but you may notice fractures of the orbital floor, the anterior and lateral maxillary sinus walls, and you'll think, could this possibly be a ZMC fracture? You'll examine the 4 suture lines, and if you see fractures of zygoma or displacement of zygoma, you become highly suspicious that this pattern is a ZMC fracture pattern. Finally, in our sagittal view, you'll be able to appreciate a lot of these suture lines in more detail. Here we have our zygomaticotemporal suture, ZT suture, between the zygoma and the temporal bone. And as you can tell in this view, you'd be able to see an arch fracture quite clearly. However, the axial view is usually the easiest. Then we have our zygomatical suture, ZF. Internal to the orbit, we have our ZS suture, which is difficult to see in this view. Finally, we have our orbital floor, which is very easy to see here. And remember, displaced zygomatic fractures will almost always have an orbital floor component that can be visualized, as the zygoma forms the lateral and inferior borders of the orbital wall. That concludes our approach to ZMC fractures. As you can tell, it's a fluid approach that requires knowledge of the anatomy of not only the zygoma, but of many adjacent structures. Now let's go through some examples of fractures and what we can do to assess them in a stepwise manner.